Bismillahirrahmanirrahim. Pharmacology, BSN third semester, Unit 2, Anti-Malarial Drugs, fast reading. KMU के स्लाइड्स हैं, जस्ट फोकसली सुनना है. आई होप यू लर्न कॉन्सेप्ट बस्ट रिवीजन के लिए और फर्स्ट टाइम स्टडी के लिए कि कल कॉलेज में इसका क्लास है और आपने फर्स्ट रिवीजन के लिए समझने के लिए कि व्हाट इन दिस चैप्टर, तो इसके लिए ये लेक्चर इंपॉर्टेंट है. सो define most commonly used category of anti-malarial drug that are used to prevent and treat malaria. Briefly discuss action and effect selected drug category. List some of the most commonly used drugs for each drug category. Discuss the nursing measures, patient education which be taken if patient using anti-malarial drugs. Introduction. Malaria is major health problem in Pakistan and tropic. Malaria caused by 4 species of Plasmodium. First is Vivax, second is Oval and Falciparum and Plasmodium malaria. मलेरिया के साइन एंड सिम्टम क्या होंगे? जिस पेशेंट को मलेरिया है तो उसमें सेंट्रल में हेडेक होगा, सिस्टमिक में उसको फीवर होगा, मस्कुलर में उसको फैटिग और पेन होगा, बैक में उसको पेन होगा, स्किन उसमें चिल्स, उसको सर्दी लगेगी, स्वेटिंग होगा और रिस्पिरेटरी में ड्राई कफ होगा, स्प्लीन में इनलार्जमेंट होगी जो वो असेसमेंट से पता चलेगा, स्टमक में उसका नोजिया एंड वोमिटिंग होगा. लाइफ साइकिल ऑफ मलेरिया क्या है? लाइफ साइकिल बहुत ज़रूरी है क्योंकि इसमें ड्रग ऑफ एक्शन होता है और ड्रग साइकिल में कौन से एरिया को हिट करता है इज़ आवर वेपन. ये है, यहाँ से स्टार्ट करते हैं कि ज़ायकोट बन गया, फिर ओकाइनेट बन गया और ओकाइनेट फिर स्पोरेंजी सेक्चुअल जो मॉस्किटो में है तो वो स्पोरोजाइट मॉस्किटो ने बॉडी में एंटर की, मॉस्किटो स्पोरोजाइट्स लीवर में चला गया, स्पोरोजाइट से मीरोजॉइट बना, मीरोजॉइट फिर आरबीसी पर एक्ट करता है, वो वहाँ से शीजोंट बनता है और फिर वहाँ से गेमेटोसाइट्स बनते हैं उसमें थ्रू द डिवीजन, और फिर वहाँ से दोबारा जब कोई मॉस्किटो उसको बाइट करता है तो अगेन ये साइकिल चलता है. Life cycle. The causative organism is a plasmodium. Vector definitive host female anaphyllus mosquito है. Intermediate host human being is the intermediate host है. Life cycle occur partly inside the mosquito, sexual sporangi and men में asexual Shizogoni. Mosquito bites man. It transmits sporozoites to his blood. Sporozoite travel to liver where it reproduces asexual tissues. Shizogoni producing merozoites. Merozoites infect new RBC and initiate asexual multiplication in RBC blood shizogoni, leading to production of more merozoites. The RBC bursts and start the infective cycle. Some merozoites develop into male and female gametes. Some merozoites remain dormant in liver hypozoites, which can cause and replace of infection later. Vivax are oval. When mosquito bites an infected person, gametes are taken up with the blood. The gametocytes mature in the mosquito gut and fuse to form an ookinete, which develop into sporozoites, sexual sporangi. Sporozoites migrate to salivary gland and infect a new host when mosquito bites the person. Recurrent malaria can be relapse. Hypozoites are recrudescence and parasites surviving in blood due to the incomplete treatment. एंटी मलेरियल ड्रग्स. अब हम ड्रग्स यूज़ करेंगे ताकि मलेरिया को ट्रीट कर सकें. ट्रीटमेंट प्रोपाइलैक्सिस आर प्रिवेंशन ऑफ रिलैप्सिस ऑफ मलेरिया. थेरेप्यूटिक क्लासिफिकेशन ऑफ एंटी मलेरियल ड्रग्स. तो इसकी जो क्लासिफिकेशन की है, नंबर 1, टू प्रिवेंट क्लिनिकल अटैक ऑफ मलेरिया प्रोपाइलेक्टिक. The causal prophylactic attack the pre-erythrocytic phase in liver, which is the cause of malarial infection. Tissue schizontocytes. इसके लिए primaquine and proquinel. Suppressive prophylactics suppress the erythrocyte phase and prevents attack of malaria fever, e.g. chloroquine and proquinel and mefloquine. Prophylaxis advised in non-immune travelers to endemic areas. Non-immune persons living in endemic areas for fixed time. Army units, infants, children, pregnant women in endemic areas. Therapeutic classification. To treat second, to treat clinical attack of malaria. Clinical curatives attack the erythrocyte schizoids and terminates episode of malaria fever. Erythrocyte schizontocyte. There are fast acting high of effect ones: chloroquine, quinine and artemisinin. Slow acting low of drug, e.g. proquinol, pyrimethamine, and sulfonamides. To completely eradicate the parasite from the body, a radical cure indicate only in vivax and plasmodium ovale because they produce relapsing malaria due to persistence of hypozoites, e.g. primaquine. For gametocidal drugs helps in decreasing the transmission of malaria from infected person to another. No use to the infected person. Primaquine and proquinol, pyrimethamine. दिस इज़ द लाइफ साइकिल ऑफ मलेरिया कि हाउ इट एक्स स्पोरोजॉइड्स लिवर में गए तो वहाँ पे उससे मीरोजॉइड बना, मीरोजॉइड आरबीसी पर एक्ट किया और वहाँ से शीजोंटोसाइड्स ब्लड शीजोंटोसाइड बना, फिर यहाँ से आगे डिवीजन होता है। केमिकल क्लासिफिकेशन उसको हमने फोर्थ अमाइनो क्यूनोलॉन में किया है। फोर्थ अमाइनो क्यूनोलॉन में जो ड्रग्स आता है क्लोरोक्विन, एमोडाक्विन, पिपराक्विन, क्यूनोलॉन, मिथानॉल, मेफ्लोक्विन आता है। सिंचोना अल्कलॉइड में क्यूनाडाइन आता है एंड बेगोनाइड्स में प्रोक्यूनेल आता है। डाया अमाइनो पायरामाडीन्स में पायरामीथामाइन आता है। सल्फोनामाइड में सल्फोडाक्सिन एंड डिप्सन आता है। केमिकल क्लासिफिकेशन 8 अमाइनो क्यूनोलॉन में प्रीमाक्विन, टिफनोक्विन एंड नेप्टोक्विन, एटोवाक्विन एंड नेप्तिरेडिन में पायरोनेराडाइन, अमाइनो अल्कोहल, हेलोफेंड्रीन, लूमिफेंड्रीन, सिस्कोटरपाइन, लैक्टोन्स, आर्टिसुनेट, आर्टिमेथर, आर्टिरोलिन। क्लोरोक्विन rapid action erythrocytic schizontocide of all species of Plasmodium, control clinical attack in 1 to 2 days. Mechanism of action: Plasmodium digest hemoglobin to heme and globin in their acidic vacuole. Globin is used by Plasmodium for nutrition. Heme, being toxic to Plasmodium, is converted to non-toxic pigment hemazoin by heme polymerase enzyme of the parasite. Chloroquine concentrates inside the acidic vacuole of parasites and raises the pH of vacuole, interferes with the conversion of toxic heme to non-toxic hemazone by inhibiting heme polymerase. Chloroquine heme complex formed damaged plasmodial membranes. Is the mechanism of action: hemoglobin, पेरोग्लोबिन यूटिलाइज बाय मलेरियल पैरासाइट और हीम जो होता है वो उसको अदर केमिकल में कन्वर्ट कर देते हैं मलेरिया पैरासाइट। वो क्लोरोक्विन एंड मेफ्लोक्विन यहाँ पे हम यूज़ कर सकते हैं ताकि इस चीज़ को हम इनहिबिट करें, हीम को हीमाजोन में कन्वर्ट ना करें ताकि पैरासाइट के लिए ये पैरासाइट को किल कर सके, उसमें टॉक्सिसिटी पैदा हो, वो मज़ीद डिवीजन नहीं कर सकेगा। Chloroquine resistance. Chloroquine resistance is fast developing in Plasmodium falciparum and is major problem because several cases of malaria are caused by this species. Resistance developed due to of a mechanism, pharmacological action. Antimalarial activity. Other parasitic infection, gardiasis and extraintestinal amoebiasis. Other actions: anti-inflammatory, antihistamic and local anesthetic, weak smooth muscle relaxants, anti-arrhythmic activity. Pharmacokinetics: good oral absorptions concentrated in liver, spleen, kidney, lungs, skin and leukocytes. Selective accumulation in retina, ocular toxicity on prolonged use. Metabolized in liver, excreted in urine. Half-life 3 to 10 days due to tissue binding. Small amount persists in body with terminal half-life 1/2 of 1 to 2 months. Adverse drug reaction occurring at low dose या short duration use. Nausea, vomiting, anorexia, epigastric pain, uneasiness, itching, headache, difficulty in accommodation occurring at high dose, prolonged use. Loss of vision, retinal damage, corneal deposits leading to diminished vision, loss of hearing, mental disturbance, graying of hair, rashes, photoallergy. Contradictions: liver damage, severe GIT, neurological or retinal hematological disease should not be co-administered with mefloquine, amiodarone, and antiarrhythmics. Can be given in pregnancy. Therapeutic uses: malaria used for clinical cure against Plasmodium ovale and Plasmodium ovale and some other falciform that are still sensitive. Gardiasis, extraintestinal amoebiasis, and rheumatoid arthritis. Lupus erythematosus. Amiodarone and piperacin. Amiodarone, identical property to chloroquine, even chloroquine resistant strain may be effective. Piperacin appears effective in resistant cases. Mefloquine, quinoline methanol, developed to deal with chloroquine resistance Plasmodium falciform, rapidly acting erythrocytic schizonticides of chloroquine sensitive and resistance Plasmodium clinical curative, also of effective suppressive prophylactic for multi-drug resistant P. falciparum. Mechanism of action similar to chloroquine. Adverse effect: nausea, vomiting, diarrhea, QT prolonged, and neuropsychiatric reactions, ataxia, anxiety, and hallucinations. Contradicted in psychiatric disorder, cardiac conductions defects first trimester of pregnancy. Quinine, L-isomer alkaloid isolated from cinchona bark. Quinidines is D-isomer used as antiarrhythmic mainly and as antimalaria. Erythrocyte schizonticides against all Plasmodium including CQ and MDR P. falciform but more toxic than CQ. Also kills gametes of P. vivax. Mechanism of action similar to chloroquine. Adverse drug reaction: synchronisms, large single dose, higher therapeutic doses for longer period. Tinnitus, nausea and vomiting, headaches, mental confusion, vertigo, difficulty in hearing, and visual disturbance, diarrhea, flushing, and and perspiration. Still higher doses, exaggerated symptoms with delirium, fever, and tachypnea, respiratory depressions, pulmonary edema, hypoglycemia. Idiosyncrasy: in some individual, synchronisms develop at therapeutic doses itself. Occasional hemolysis in pregnant women and patients with P. falciparum, hemoglobinuria, black water fever, kidney damage. Uses: malaria, uncomplicated resistance falciform malaria, oral quinine given, complicated and severe malaria including cerebral malaria, IV quinine used, and nocturnal muscle cramps. Begonides या progenyl it exerts its antimalarial action by inhibiting parasitic dihydrofolate reductase enzyme. Begonides converted to cycloguanil active compound acts slowly on the erythrocytic stage of vivax and falciform, prevents development of gametes. Adverse effects: stomatitis, mouth ulcer, larger doses, depressive of myocardium, and megaloblastic anemia. Not a drug for acute attack. Causal prophylaxis: 100 to 200 mg daily. Pyrimidines and pyrimethamines. Mechanism of action: selective, inhibit the plasmodial form of dihydrofolate reductase, reducing the production of folic acid required for nucleic acid synthesis in malarial parasite, more potent than proguanils and effective against erythrocytic form of all species. Used only in combination with sulfonamides for malarial treatment. Tasteless, so suitable for children. Adverse effect: megaloblastic anemia, thrombocytopenia, and agranulocytosis. Sulfonamides या sulfadoxine, long-acting sulfonamides. Sulfadoxines are not effective antimalarial, but combination with Pyrimethamine causes sequential block of folic acid synthesis in Plasmodia, effective against erythrocytic stage of P. falciform. Combination acts faster and prevents development of resistance. Risk of hypersensitivity reactions due to sulfonamides component. 8. Aminoquinolone, primaquine and tefnoquine. Primaquine most active against lower hypnozoites pre-erythrocytic phase. Weak action against erythrocytic stage of 5x. No action against erythrocytic stage of falciparum. Has gametocidal action against all species. Primaquine mechanism of action. Primaquine converted to electrophiles generates reactive oxygen species, interferes with oxygen transport system. Uses and adverse effects of primaquine. Primary use is radial cure of relapsing malaria in PYX. 15 mg daily for 14 days with dose of chloroquine. Gametocidal in falciparum malaria. 45 mg of single dose with chloroquine and cut down transmissions of malaria. Adverse effects: gastrointestinal, epigastric distress, abdominal cramps, hemopoietic, mild anemia, cyanosis, hemolytic anemia in G6PD deficiency. Avoided during pregnancy. G6PD patients. Tefnoquine. Tefnoquine, more active, slowly metabolized along of primaquine, has advantage that it can be given on weekly basis. Single dose anti-relapse therapy for VIVX malaria. Neptoquinone, atovaquone, synthetic neptoquinone, rapidly acting erythrocytic schizonticides for Plasmodium falciparum and other Plasmodia. Mechanism of action: collapses mitochondrial membrane and interfere ATP production. Proguanil, potentous actions of atovaquone and prevent development of resistance. Neptiridyne and pyroneradine. Pyroneradines PYR is an erythrocytic schizonticides with a potent antimalarial activity against multi-drug resistant Plasmodium. The drug is used in combination with atrosonates pyramex for the treatment of uncomplicated P. falciparum malaria in adults and children. Mechanism of action: partly understood mechanism of action with at least two important activity pathway: the inhibition of heme in hemozoins convergence and the intercalcating DNA and topoisomerase 2 pathway, prominently implicated in antimalarial and anti-cancer activity respectively. Adverse effect: well tolerated, the most common side effect being headache, vomiting, abdominal pain, bradycardia and hypoglycemia. Amino alcohol, halofentrin and lumifantrin. Lumefantrine is an antimalarial agent administered in combination with atrimere for improved efficacy to treat acute uncomplicated malaria. This combination therapy exerts its effect against the erythrocytic stage of Plasmodium. Mechanism of action: lumefantrine binds to heme produced during the hemoglobin breakdown, preventing detoxification to hemogens. During the same process, the peroxides group is artemether bind to heme and releases toxic free radicals. Side effect of combination artemether and lumefantrine therapy include headache, anorexia, dizziness and asthenia. Possible series adverse effects include Q2 prolongation and bolus eruptions and urticaria and splenomegaly, hepatomegaly, hypersensitivity reaction. Cis Q terpene lactones artemisins. Artemisinin is the active principles of the plant Artemisia in the most potent and rapid acting against blood schizonticides of P. falciform, resistance to all other drugs. Due to the short duration of action, there is high recrudescence rate. Mechanism of action: these compounds have endo-peroxide bridge. Heme iron cleaves this endoperoxide bridge to form highly reactive free radical which damage Damage parasite membrane by covalently binding to membrane proteins. Artemisinin derivatives, artesunate, artethers, and arterolane. Artesunates, water-soluble ester of dihydroartemisins. Dose can be given oral IM, IV, rectal, oral. Dose 100 mg BD on day 1, 50 mg BD day 2, day 5. Parental 120 mg on day 1, 2.4 mg per kg BD. 60 mg OD 2.4 mg per kg for 7 days. Artemether, methyl ether of dihydroartemisinin, dose oral and IM. 80 mg BD on day 1, 3.2 mg per kg. 80 mg OD 1.6 mg per kg for 7 days. Adverse effect, mild adverse effect like nausea, vomiting, abdominal pain, throat fever, itching, tinnitus, dizziness, bleeding, dark urine, ECG changes, QT prolongation, and leukopenia are rare. Uses uncomplicated falciform, CUQ sensitive and resistant, severe and complicated malaria given parenterally. Artemisinin based combination therapy ACT. Artemisinin compound are shorter acting drugs. Monotherapy needs to be extended beyond disappearance of parasite to prevent recrudescence. This can be prevented by combining artemisinin compound with one long acting drug like mefloquine, etc. Why combination therapy? Rapid clinical and parasitological cure, high cure rates and low relapse rate, absence of resistance, good tolerability profile, ECT regimens in use, artesunate, sulfadoxine, pyrimethamines, artesunate, mefloquine, artemether, lumefantrine, artesunate, amiodarone, arterolane, and piperquine. Antimalarial drugs, nursing implications. Before therapy, through the health history, medication history, assess for allergy, check baseline VS, also check for contradictions and interactions. Administer all drugs as ordered and for the prescribed length of time. Most drugs should be taken with food to reduce GI upset. Instruct patient to notify physician immediately if ringing in the ears, visual difficulty, nausea, vomiting, profuse diarrhea, or abdominal pain occur. Alert patients to be possible recurrence of the symptoms of malaria so that they will know to seek immediate treatment. Thank you. Allah Hafiz.